In this demonstration, I'm the planning administrator for our multi-facility healthcare provider. We operate 2 facilities, each with many departments, offering both inpatient and outpatient services. I've used Alight Planning to create a complete 2011 plan, and after a few months passed, incorporated 2 additional months of actuals and created the 2011 March forecast. Both the plan and forecast leverage Alight's driver-based planning features and support agile planning. As the administrator, I can manage the structures, the dimensionality, and the security for the model under the Setup tab. Here, under Financials, I'll find 3 summary level statements: an integrated P&L, balance sheet, and cash flow. Data changes that affect the P&L can and most likely will drive changes to the balance sheet and cash flow statement. Alight Planning automatically keeps all 3 statements in sync. If I'm interested in getting directly to the underlying details of my model, I can select any worksheet here. The first 5 worksheets house financial data that ultimately will roll up into the P&L or balance sheet and cash flow statement. These next 2 house non-financial data, such as standard rates, price tables, and calculated metrics. But because you can link anything to anything in Alight, this data, as well as any data in our model, can drive any calculation. Let's see how we can leverage Alight's features to analyze our P&L. On any financial statement or worksheet, we can control what data we're looking at by using our control panel. This control panel is customizable for each user and report. It can be as complex as what we see here as an administrator, or much more simplistic depending on each user's requirements. Here I see I'm working with the 2011 plan, a scenario called Base Case, and a report called the 2011 Monthly Plan. On any report, whether it's a financial statement or a worksheet or an ad hoc report, I can roll up information to see a summary level statement or drill down through the layers to investigate the details. Here, gross revenue is made up of inpatient revenue and outpatient revenue. If I'd like to investigate inpatient revenue, I simply double-click to see the departmental inpatient revenue. Now you can also drill down on operating expenses, here, which are categorized into various groups of expenses, and I can drill down there on supplies to see my individual groups of supply expense. If I double-click at the lowest level on a P&L or balance sheet, I'll automatically be transported over to the worksheet that contains the details for that expense or revenue. We can control what data we're looking at by changing our selections here on our control panel. We have 2 time frames, a 2011 plan and a 2011 March forecast. That March forecast will incorporate 2 months of actuals and 10 months of reforecasted data. Within the plan time frame, we've created a number of scenarios to help us better predict our future. These scenarios let us analyze what certain changes mean to our overall model and what that impact of a change or multiple changes would mean to our P&L, our balance sheet, and our cash flow statement. Using reports, we can generate various views of all of this data. Reports can include any time periods, whether weeks, months, quarters, for both plan or actual data. Let's have a look at the 2009 through 2013 report. This report incorporates a number of years of actuals, as well as plan information going forward. Now it's a long report, but if I deselect the details, you'll see just the total columns. And here we have 2009, 10, 11, 12, and 13 side by side. Let's have a look at another report, maybe the 2011 by quarter report, which gives us summary information for each quarter and then a total at the end of the report. If we choose details, we'll see the months that make up the quarters. You can also show variance reports. Here we're looking at February actual data, side-by-side February plan with a variance. And remember, as I roll up and drill down to the underlying details, I'll be able to investigate those variances. These reports are universal, meaning they're available from any financial statement, worksheet, or ad hoc report. They're very easy to create as well. For example, if I wanted to create a new report and call it Q1 2011, I can simply choose the columns I'm interested in, perhaps January and February actuals and March 2011 plan, and I'll use an operator column for a total period and change that to read Q1 total. And very quickly, a matter of seconds, I have my report. 2 months of actuals, the plan for March 2011, and a Q1 total. It's been added to my list so I can choose this coming from any financial statement or worksheet. Filters allows us to filter through based on the dimensionality of our model. Here I can select from predefined filters to go from a consolidated organizational view to just my Newtown P&L. Or perhaps I want a P&L that includes only administrative departments, meaning we shouldn't see any revenue generated here, but only operating expenses. Or the patient care departments. That should reduce our expenses by the operational expenses our administrative departments provide and just show us the revenue related to patient care departments. You can create named filters and keep those named filters to be referred to at any time. I'm going to drill down on my revenue section of my P&L until I get to the lowest level, double-click, and now I'm on my revenues worksheet where I can continue to drill down and see what makes up the detailed revenue for that area, ICU. You see I have revenue in both Newtown ICU and Old Town ICU, my two facilities, and then it's broken out by payer. And I'll see my revenue projection over here on the right-hand side. Now, Alight has a units, rates, amount architecture that we leveraged here when building this area of our model. Our units are our statistics times a billable rate, and that gives us our billable inpatient revenue. I can turn on one of my dimensions here to show the driver, what's the units all about. For ICU, I see it's patient days, but if I scroll down, oops, just used my mouse there. If I scroll down here to ER and drill down, I can see those stats are my visits. So you can have multiple stats for your various departments. This gives us a lot of information on reports that show variances. I'm actually even able to import the actual data for total revenue and units and have the rate back calculated. So at this level, I can have a comparison report, not only a variance and a variance percent, but a causal analysis that tells me how much of my variance is due to the units being off or the rates being off. You can really tell a lot about your data by looking at information just like that. Like on the P&L, you can use your named filters, those very same named filters, to filter through your data on any worksheet or ad hoc report. However, you can also now use any of the dimensions of your model to filter through and show just certain information. So very quickly filtering through your data and saying something like, I want to just see Newtown E and ER, and you'll see the revenue, the contractual discounts, and anything else that is related just to that one department. You can also pick groups of departments based on hierarchies. So here I only want to see Old Town, and now I'll see both the revenues, the discounts and contractuals, and any charity care related to those departments. Beyond departments, I might want to say, let me see only information for Blue Cross. And now as I drill down on gross revenue and ICU, you'll see I only see my revenue for Blue Cross. So filters really allow you to just hone in on what you're looking for at the moment. In Alight, anywhere you see a shaded cell, it means you can type in a new number, new input value. I could have made these shaded cells and we could be typing in this information, but instead I chose to keep the input information elsewhere. There's a rate table that this information refers to and is linked to, as well as underlying details that drives my patient days. I can access that data by opening up my key measures. Key measures is a secondary pane that I can resize, and I can house certain information. So let me just open it all the way up here so we can see a little bit more data. This information can come from any worksheet in the model and be grouped into groups that make sense for you. So here I have some information that's being calculated for my revenue cycle data, or some even just being input. Some other key metrics like operating margin percent and debt service coverage. And here's some input data, my payer mix. My payer mix here I can just make quick changes to, and that would impact any of my information on the revenues worksheet and my financial statement. So let's make some changes. Let's say starting in February, actually let's start in April, Medicaid is going to go up let's say to 40%. So I'll just type in a 40 there. But then we know that by the end of the year, by December, we know that really should be, say, 44%. You may be noticing that my self-pay is changing so that the total always stays at 100%. Now, between those time periods, I want to ramp that information up so that it's a sort of a straight line between April and December. So I'm going to use my spread methods to ramp between points. You might have noticed you can increment by percent, increment by value. You can do all kinds of neat things using that spread option. So I've made my changes here, and what's been changing all that time is my revenue projection. You can see here Medicaid should be going up starting in the month of April, higher than it was before this. Now there are other information here that would pertain to these numbers, my patient days, not just payer mix, but the number of inpatient admissions I have, the length of stay those people stay, that calculates to be patient days. Here's that bill rate table, the standard table that I'm linking to all of my revenues. So if I were to make changes here, say increase these numbers here for Old Town, let's go ahead and increase the whole range starting in March for both inpatient and outpatient rates, and I'll say increase that, not increment, but add percentage to each 10%. Those rates are going up starting in the month of March through May, and maybe I'll take the time to then change June and out. So what I've done there is made a change to these billing rates. They've now gotten higher starting in the month of March. Key metrics can hold other information beyond just this. It's up to you, perhaps some other statistics, maybe some charity percents, maybe your discount percentages for certain payers, or if you have payers that use calculations such as this, like base admission, base per visit, and a factor for your case mix index. I've shown you how universal reports work across financial statements and worksheets, but now I'd like to show you that they also work on ad hoc reports. Ad hoc reports are reports that you can use to show all of your data or subsets of your data coming from one or many worksheets together on another type of report. Here I've asked to show all of my revenue on this report, and I'm showing dimensionality. You can show all of your dimensionality pertaining to that data. Here I've chosen just to show sort of the revenue categories, that roll-up structure, and the payer. So if I drill down on any one of these categories, I'll see payer. Right now I'm looking at my monthly plan for 2011 in the scenario called ACA Impact on Medicaid, and I can see my total revenue, my discounts and contractuals, charity, and just the bottom line revenue or net revenue. However, if I move these columns around and move payer to be my first column, I'll still have the same total at the bottom of my page, but a very different looking report. Let me go ahead and roll that up, and then we'll drill down to show our payer, and then if I drill down from there, I'll see my revenue and discounts for each of those payers. So Alight's ad hoc reports allow you to look at that very same data using its dimensionality for a drill down path. In this demonstration, I'm the planning administrator for a multi-facility healthcare provider. We operate 2 facilities, each with many departments offering both inpatient and outpatient services. I've used Alight Planning to create a complete 2011 plan, and after a few months passed, incorporated 2 additional months of actuals,